Welcome to Laser Eye Center. Now, how many locations do you have? Because we're in one right now.
We have 8 locations,
Right.
5 surgery centers and 3 satellite offices. We provide, the full spectrum of refractive surgery and cataract surgery with state-of-the-art technology.
This is Dr. Shamus, Abraham Shamus.
Correct.
And Dr. Rainey Wu. And they're going to take us through Laser Eye Center today and easy anxiety and fear of getting your eyes corrected.
We'll make it soft and clear and relaxing.
Oh, we're going to have a good time. Let's go inside.
A diagnostic machine that we take pictures preoperatively, before the surgery, to determine if the patient is a good candidate for surgery or not. They are very different. One is called Humphrey, the other one is called OrbScan, and here we have an automated refractor. So basically everything is digital. We take these pictures, we analyze them, and after we determine that you are a good candidate, you will go to the second step, which is the surgery itself.
Let me dumb that down for you. What they do is make sure that you are okay to get your eyes fixed. They won't fix them unless you know you can do it error-free.
Absolutely. To be a good candidate, you will go through stringent, evaluation as far as your corneal thickness, the shape of the cornea, and the health of your eye. So everything has to be okay before we give you clearance for surgery. We turn down some patients and we tell them you are not a good candidate. So not everyone goes through here will have the procedure.
And I don't want to brag, but I didn't get turned down. And I just got my eyes checked. 4 years later, still have 20/20.
Wonderful.
Thanks to this doc.
All right.
So if you were to come in for a cataract consult, we bring
Wait, hold on, I gotta introduce you.
Oh, okay.
So this is Dr. Wu. Now, a lot of people ask if Laser Eye Center fixes cataracts, and you guys do. With Dr. Wu.
With me.
All right, now what am I doing right here?
So if you came in for a cataract consult, you would come to this machine, which is our IOL Master, and I would take a couple of quick measurements. We'd measure the surface of your cornea and also the length of your eye, and that'll help me select which lens we're going to put in.
Way over my head, but it works. How long does the process take to fix your cataracts?
The surgery is about 15 minutes or less.
Can you
It's
imagine?
very fast.
You have cataracts for years and it takes 15 minutes to
Yep.
fix it.
No pain. We give you anesthesia, mostly local.
Where's
No
the patient? I want to try to fix one.
Where's the...
Come on.
You're ready?
We're going to go fix some
Ready to go,
cataracts.
doctor?
Let's go.
All right.
Okay, Dr. Shamus, this is the first stage of the surgery, right?
That's correct. This is called the intralaser, where we create the flap with the laser. We don't use any blades. The process is computerized and takes around 12 to 14 seconds.
What that means is that you just took your Xanax and you don't even care what's going on right now.
Exactly. We do one eye at a time and you won't feel anything. You feel a little bit of a pressure that lasts a few seconds and we are done.
And then after that, you go to CONTOURA.
Then we go to CONTOURA.
CONTOURA!
The standard of determining vision or visual acuity used to be 20/40, 20/20. If you want to pass through the MV test, the minimum is 20/40. So our standard used to be that scale. Now we went to another scale, is what we call quality. And how to determine quality is very difficult. So we came to the CONTOURA. CONTOURA is a new way of shaping the eye. It's called topographically guided. It will shape your cornea in a uniform fashion, so you will have no side effect or minimal side effect. There will be no halos, no glare, and you get the quality of the color. Patient will say, oh, I see it, it's so fresh, beyond the clear. So we are taking the vision to another scale right now. And if we want to compare it to 20/20, we can tell the patient you are to the 2015 range even. But that's not the issue whether 20/20 or 2015, it's that sharpness, that light that you see when you look at the scenery and you see it crispy and clear with no glasses and no contact lenses.
Let me dumb that down for you. You know when you're watching HD television, you're like, wow, that's way too clear to be real? That's what CONTOURA does.
Exactly.
Fist bump,
and
Doc.
this is the way.
Fist bump. There
This
we
is
go.
a good one. That's a good way to the HD or the 3D dimension, but in quality.
Right.
Then we have the numbers. Of course, we do care about the numbers, the 20/20 and the 2015. We are going to achieve that, but now we are going to a different orbit it's the clarity, the quality, the 3D dimension that you are talking about, the HD.
This is where you lay when you get your eyes done. It's relaxing. It takes like 2 minutes. Don't do them again though, Doc. All right, with Dr. Chavez now in your office, and
You're welcome.
this is where you sit down with the patient. You offer free consultations here, which is amazing.
True. That's correct.
Yeah. So they would just call, come in, and you tell them what? I already know the answer because I've done this before, but
Of course.
I want to
of
hear
course.
your response.
Of course. The patient comes in, we do a basic evaluation. We take the vision and we take the picture that I talked to you about, you know, the topographies, the thickness of the cornea, and then we make sure that the patient needs. Most patients, they don't want to wear contacts, they don't want to wear glasses.
Like me, I didn't want
like
that.
you,
Yeah.
exactly. And then we determine if the patient is a good candidate. After that, they will see a video that will explain the procedure in full details. And explain the first part of the procedure will consist of creating the flap with the laser. We don't use any blade, it's all laser LASIK. And the second one is the second part of the procedure, the CONTOURA, which is the state of the art in taking your vision to another level. And after that, I will sit with the patient and go over the findings, the expectations, and answer all the questions. And from there on, we book the patient for the procedure.
How safe is Contoura? I'm going to pretend I'm a patient now. How safe is Contoura?
You know, technology has come so far over the years. And I understand you had your surgery 4 years ago.
I did.
And now the technology is advancing. It's faster, safer, more accurate, and the Contoura that came into light the past year or 2 years, I would say, has added another level of quality to the vision. So it is very safe in the good hands.
Here's the best part. How long have you been doing eye surgery?
I've been doing eye surgery for more than 25 years.
25 years. Very safe, very reliable, and I can say as a patient, it's been 4 years, my vision's never been better. And
Wonderful.
I love it. Still love taking a shower.
I'm so happy you're doing so well.
Thank you, Doctor. Dr. Chavez, Dr. Wu. Book your consultation right now, lasereyecenter.com.